Hello, I want to talk to you today about some of the physiological changes that your body is going through during pregnancy and how strengthening your core muscles might help with some of the symptoms that you may be experiencing. Looking at your pelvis is made up of an ilium this side, so starting at your pubic bone at the front, coming round to your sitting bones underneath, all the way around to the back and meeting at your sacrum in the middle and coming up to your spine. This joint here is called your sacroiliac joint, and around the front, your pubic symphysis. Generally, it's a really strong joint and not a lot of movement happening around the back of your pelvis or around the front. What happens during pregnancy? You get an increase in the hormone relaxin. That relaxin can affect all of the ligaments around this area and actually throughout your whole body. What that does is very slightly increases the movement around this area here and around this area here, which of course is exactly what you want to prepare for delivery. But what it can mean is about 70 to 80% of ladies can experience some discomfort around this area and this area during pregnancy because of that increase in movement. Also during pregnancy, you get a change in the smooth muscle throughout your body. So the smooth muscle can affect your bladder and your bowel. And that effect on your smooth muscle can lead to an increase in urinary leakage and also an increase in urinary infections. So what can you do to counteract these changes? So your pelvic floor muscles go underneath the whole of your pelvis here. They go underneath the whole lot like a bowl, and also they come up several layers within your pelvis as well. And your pelvic floor muscles are there to keep everything up in the right place and also closed at the right time. So strengthening your pelvic floor can help with the strength and the stability around your pelvis, but can also help reduce the potential for infection and incontinence. Also, strengthening the muscles around this area, so potentially your transverse abdominis across here, your pelvic floor, your glute muscles at the back, your lower back muscles, that can all help with the stability around your pelvis and help reduce the movement and therefore reduce some of the discomfort that you might be experiencing. As well as that, you'll be potentially experiencing a change in your biomechanics as well. So looking at your pelvis from the side, as your baby grows, it can change your centre of gravity. So the weight of the baby tends to bring your pelvis into more of an anterior tilt. It means that your abdominals are a lot weaker, and also that anterior tilt often means that your lower back muscles are a lot more arched here. So you tend to get a larger arch in your lower back. That can lead to a weakening of your glute muscles and a tightening of your lower back muscles. In addition to that, at the same time, you'll be tending to get more of a flare of your rib cage to allow space for your baby to grow. That flare in your rib cage can affect the muscles down the side of your body and again down the front of your body, and can again lead to more of an arch in your lower back and again discomfort. So working on the muscles around the back of your pelvis, the underneath, the front, and all the way up to your rib cage, and making sure that they're strong can really help to reduce some of the discomfort that you might be experiencing at the moment. So I'm going to go on to tell you about some of the exercises that I would recommend that you're doing at the moment. Pelvic floor muscle exercises during and after your pregnancy. You can do your pelvic floor muscle exercises anywhere, laying down, sitting, standing, and with exercise. To do your pelvic floor muscle exercises, you need to engage your back passage, like you're stopping yourself from passing wind, tighten the front passage, and then pull up inside. You should be doing these exercises, some slow ones and some quicker ones. So for the quicker ones, you need to do lift, let go, lift, let go, lift, let go. And you want to do about 10 of them or until your pelvic floor feels more tired. And then you can do the slower ones, which is lift again, so back passage, front, pull up inside, hold that for 10 seconds, and then release. And then wait a few seconds in between each lift, and then lift again. So back, front, pull up inside, engage through the pelvic floor, and hold for 10 seconds. And then letting go. It's important to make sure that you're letting go in between each contraction as well. So I like to think of it a little bit like your pelvic floor is on the lift shaft. So when your pelvic floor is fully engaged, it's all the way up to floor 10, and when it's fully relaxed, it's all the way down to the ground floor and then even down to the basement. No pushing, just fully letting go. You should do these exercises about 3 times every day, and then you can start them again straight after pregnancy as soon as any catheters are removed. Have a lay on your back with your feet hip width apart, your arms relaxed by your sides and your head supported by a towel. You're going to start off by engaging through your pelvic floor, so back passage, front, pull up inside, and then starting to squeeze your bottom muscles and peel off of the mat. So you're going to peel off with your lower back, middle and upper. And then you're going to gently lay back down your upper back, middle back and lower back. Repeat these a few times until you can feel a bit of an ache in your bottom muscles. So getting a nice posture with your feet hip width apart, knees nice and soft, and your core engaged all the way through your pelvic floor. And then just allowing one arm to go down the side of your leg and the other arm to lift up on the other side, and alternating from one side to the other, gentle breathing in between. Very good work for your internal obliques and core strengthening. You can see here what Tash is doing is just engaging all the way through her pelvic floor from back, front, pull up inside, engaging her lower abdominals, and as she's doing that, she's just tucking her tail under. You can see she's very arched in her lower back, and just as she softens her knees and tucks that tail under, she's able to just flatten her back a little bit, which may well reduce any discomfort that she's having. You can do this activity standing, and it can also feel quite good sitting on a Pilates ball.